Hello, everybody. Thank you for tuning into my talk today. I am very grateful for the opportunity to speak at the Law and Mental Health Conference. The title of my talk is Bringing Data to Policymakers, Lessons Learned from Recent Advocacy Efforts. And I hope that this is informative and helpful for folks. In addition to this pre-recorded talk, there's going to be a panel discussion, and I'm looking forward to interacting and speaking with viewers, the audience members, and other speakers at the conference. So I am going to pull up my slides, and I'm going to be speaking over a slide presentation for most of the time today. I'll begin by introducing myself. My name is Paul Gilbert. I'm an associate professor in community and behavioral health at the University of Iowa College of Public Health. My primary research area is alcohol use, and I often describe myself as a behavioral epidemiologist. By that, I mean that I study the distribution and the determinants of drinking behaviors and related harms in the population at large. I have a particular interest in treatment disparities, and I also look at other forms of help seeking and the multiple pathways to recovery from an alcohol use disorder. But in recent years, I've gotten more and more interested in the policymaking process and wanted to figure out how I could support it, how I could play a role in policymaking. It was not part of my training originally, but I've taken baby steps in that area. And one of the examples is I led a study to evaluate the effects of Iowa's state social host law, essentially whether it had any effect on underage drinking or not. But today, I'm going to be speaking primarily in my role as the chair of the Alcohol, Tobacco, and Other Drugs section of the American Public Health Association. Now, the ATOD section brings together over 1,300 members that come from all professions and all walks of life. It includes folks who are working in academic and research settings, such as myself, but also we have members in government agencies at both the federal and state levels, healthcare providers, students, even community members, community activists. But we are all united in our focus on substance use prevention, treatment, and policy measures. So the title of my talk today, as I alluded to at the start, is Bringing Data to Policymakers. And I conceived of this talk in that spirit of bridging, of getting out of academia, bridging the academic world with the real practice world, linking these two worlds. In the printed program, the session description is a little out of date. That's the first version that was a little bit more general. On the screen here and in the online program, you see the updated version, which reflects the focus on alcohol specifically that I'm going to be talking about today. I wanted to call out that I'm going to use several examples from the ATOD section's work to illustrate some principles, some of the lessons learned. I'm going to provide some tips based on these experiences over the course of the talk here today. So let me start with the central question that motivated this talk. Does data really inform policy? And my initial answer is no. That may be a little bit harsh, or at least it does not inform it very well. I essentially see two different worlds here. There's research and policy, and they largely pursue their own activities. And despite having a common interest, I think coordinated action is actually fairly rare. And maybe it's because our agendas and our constituencies and our methods are different in these different areas. So researchers are typically not trained to communicate their findings to policymakers or even the general public. And in fact, researchers disseminate their findings to a very limited and constrained audience, essentially their peers in the scientific research community. And their goals as researchers, and particularly academic researchers such as myself, are to publish papers and to compete for grants so that we can sustain our research careers. But people working in the policy arena, in contrast, may not have the same level of scientific background to interpret and use the research findings that academics put forth, the way at least that they're currently presented. And folks in the policy arena may not actually prioritize research as they have to attend to political pressures. Folks in elected positions may be thinking about their constituents' desires. Folks in appointed positions may be more attentive to their superiors' desires. Um, so this all leads to some disconnect. But what I think is, besides this broad generalization, you will find researchers who are out there as public scholars who are making their work more available. And you will find policymakers and staff members who are highly skilled and scientifically literate. But I think this basic distinction of two parallel but separate worlds likely holds true. And what we have a lot of times is miscommunication, missed connections, failure to talk efficiently back and forth across these two domains. And what I hope to present today are a few examples and some tips about how we might bridge that divide, how we might bring data more effectively to policymakers. So, among the three examples that I want to give you today, I'll start with a policy statement that the ATOD section proposed to the American Public Health Association. You see the title on the screen. This is taken from the website. You can look it up on the APHA website if you want. Now, policy statements are a key part of setting the direction for the American Public Health Association. These are statements of our position, our stands on issues, and it really drives the actions of the association at large. They're also important because they provide support for state affiliates in particular to take action, or anybody else for that matter. They could refer back to these policy statements and say, hey, look what this professional scientific organization is saying. They've taken a stand on an issue. Um, shouldn't we follow suit? Doesn't this bolster our argument for action at a state or a local level? At least that is the ideal situation. So this policy statement was written in response to emerging evidence that there has been growing harms from alcohol, increasing mortality, increasing instances of other sort of harms directly related to alcohol use. And we make the claim that we need to bolster policy responses to that. All of this is grounded in the scientific evidence. There's actually a very rigorous peer-reviewed process for making these policy statements. It was adopted at the 2019 annual meeting of APHA, and this was a great success, but we realized immediately that we could build on it. So the next step in essentially disseminating this policy statement more widely was to publish a journal article, essentially making the same argument, the same evidence-based claims that harms from alcohol have been increasing over the last couple of decades, and that we need to bolster policy responses to reduce those harms. Some of the policy responses included things at the federal level, like raising the alcohol excise tax, or at local levels, uh, increasing restrictions on alcohol outlet density or alcohol advertising, a couple of examples there. So among the authors of the policy statement, they wrote an opinion piece that was published in the American Journal of Public Health. Again, on the screen, there's the URL. You could look that up. Um, and this was, with the intention to reach a wider audience. And the American Journal of Public Health actually has a tremendously wide reach. It is a global publication with a very wide and diverse readership. It is the flagship public journal of the American Public Health Association. Uh, so it's a high standing, high profile journal. But let's consider one of our typical questions in public health, the so what question. Whatever we do, we have to ask ourselves, did this have any effect? So what? And I'm going to lay this out for this example and the succeeding examples in terms of successes and limitations. So the main success was that we disseminated this policy statement much more widely. That within APHA, policy statements have pretty limited appeal. As I said, it does set the direction for the association, but beyond that, not many people pay attention to it. So this was a very important step in getting the word out in the journal that has this wide and global readership, actually. That was a great success. The limitations, however, is that that journal readership is actually fairly limited to the same sort of people, the largely academic um, world, that it's really doubtful how many policymakers or folks involved in the policymaking process would be reading this, would have been reached by this journal article. It's also really hard to gauge the impact of things like this. One of the ways that we typically gauge impact in academia is by looking at citations of a paper. So once it's published, how many times do other people cite it, refer back to it? That's a good gauge of the impact in the scientific arena. Uh, as of yesterday, I looked it up, and this article, this opinion piece about the need for strengthening alcohol policy, has had 0 citations. Does not mean that it hasn't been read, uh, but no other publications have cited it. So we don't have a good way to measure its impact. And as I said, the journal itself likely has a pretty limited readership in terms of folks involved in the policymaking process. So that was a mixed bag. Let me move on to the second example of our activity here. And I think this is a really good example because we, as a section, provided expert testimony to the US Department of Agriculture and the Food and Drug Administration as they were working to finalize changes to the US dietary guidelines. Now, this was provided by our immediate past chair, Dr. Sean Haley, with the support and collaboration of a number of our members who helped prepare our remarks. But let me back up and first explain a little bit about the dietary guidelines. These set the recommendations that we're probably all familiar with, the levels of salt or sugar or quantities of different vitamins or nutrients that are recommended. It also includes guidelines about alcohol consumption and sets the thresholds for what we consider low risk or high risk drinking. So this is a very important document. It's not policy per se, but it is what we base policies on, and it has a tremendous impact, long lasting impact. And every 5 years, these are reviewed and updated. So in 2020, there was a scientific commission convened to review the evidence and to provide suggestions. One of their suggestions was that the recommended limit for drinking among men be reduced to parallel that among women. It had been no more than 2 drinks per day for men, no more than 1 drink per day for women, or looking at it by weeks, no more than 14 drinks in a week for men, no more than 7 drinks in a week for women. Below that threshold, we consider that level of drinking low risk. We can't say that it's safe. Nothing has 0 risk, but it's low risk. But this was significant, and this was indicative of the evidence of growing alcohol-related harms, the increasing deaths due to alcohol and other harms due to alcohol over the last couple of decades. And we came out in strong support of making this change. Now, it was really important that we were able to give this testimony. It represented speaking directly to the policymakers here. This was actually a big deal. But let me move on to the evaluation, the so what question. I think the main success here is that we were able to speak directly to the folks involved in this process, bringing our evidence-based recommendations along with that of the commission in support of the changes. This is much more efficient than publishing a paper and hoping that people read it. Speaking directly to people is much better. The other thing about the providing testimony is that Dr. Haley was able to speak before any of the industry representatives, and there were quite a few. So that was a big advantage in getting our message out before any countervailing messages. So the timing was really, really crucial there. But among limitations, I think this is a really mixed bag, that statements in support of public health or by folks in public health were outnumbered by testimony given from the industry, from alcohol beverage producers and distributors. And ultimately, the recommended change was not made. So there was no change in the recommended level of men's drinking. It remained the same. And we were disappointed in that. But on balance, I would count this as a success, because it really stepped up our efforts to speak directly to policymakers, to be directly involved in the process, bringing that scientific knowledge to it, even if the ultimate end result was not what we had hoped for. So there's a third example that I'll tell you about. And this was a little more than a year ago. The ATOD section convened a national network of folks involved in alcohol prevention and control efforts on local levels. This was part of a strategic priority that the section had to support local alcohol control measures, to really bolster local efforts. I guess that's the best I can say. So this network is an informal group of folks open to anybody who's interested in the topic and has been working in some way towards alcohol control measures, alcohol policy measures, with the exception of anybody in the industry. We do exclude folks from alcohol beverage producers and distributors. This is much more of the public health community, public health mentality. The network meets twice a month and has done for over a year now. And there's been a strong emphasis on information sharing, peer mentoring, making connections, and building skills that people can use in their local communities. Some examples of the skills building have been regular, what we call boot camps or short workshops on key issues, things like the nature of alcohol taxes, or the 3-tier alcohol control system. Much of the last year has been spent trying to figure out what's happening during the COVID pandemic, and especially countering moves to relax alcohol control measures. So we know in the last year, there's been a tremendous push to relax the typical sort of control measures around hours of sale, venues, licensing restrictions, and allowing things like cocktails to go or home delivery of alcohol in jurisdictions where that had never been present before. And this was really important because during the past year, the alcohol industry has really taken advantage of the pandemic as an opportunity to push some of these measures that would relax control. Most recently, one of our current projects is to do some collaborative data collection across the multiple states of the folks who are participating to get better information on what is the effect of changes allowing cocktails to go or home delivery of alcohol. So again, the so what question. We have a mixed bag here again of successes and limitations, but I am going to call out, I think, some really important successes. That we have been able to foster a number of connections. We have had high interest and high enthusiasm for this network, and people have been dedicating, twice a month to attend these meetings. We also obtained support, a small grant from the National Alcohol Beverage Control Association, to support an intern that supports the structure here. But among the limitations, this network is still relatively new. So getting on the ground or growing, experiencing some growing pains, figuring out its goals. And I have to say, again, there's been few instances of successes in stopping or modifying states' changes in alcohol control measures. We've been able to slow the process in some instances or add influence, I guess, the administrative rules for things like, cocktails to go, but we haven't been able to stop the changes entirely. But this is a growing movement, and I think the high interest and enthusiasm really shows that we've tapped into a need, that there's something here. And I think there's a lot of promise for strengthening capacity at the local level to pursue more policy changes. And out of these three examples, there are some overarching lessons that I take away when I reflect on them. And the first and most important one is that in order to influence policy, especially to bring data to policymakers, we've got to be at the table. And this became really apparent because we've heard in several instances, particularly from legislatures, that folks from the public health community have not weighed in on issues related to substance use or alcohol in particular. The legislators will hear much more quickly from lobbyists from industry, but they're not hearing from the advocates from the public health community. So in order to be at the table, this first necessary step in order to influence policy, I've got a few recommendations. That we need to build relationships with legislators, with other stakeholders, with folks who are in the policy making process early and sustain those relationships. One of our local state legislators in Iowa told me at a workshop that the best time to talk to them was in recess over the summer when the legislature is not in session, when they have more time to talk, that it's less efficient to approach them in the heat of the session when bills are coming at them rapidly, when they're having votes rapidly. They may not have the time, but they also want to know who are the trusted voices, who could they turn to for advice on an issue that they may not be familiar with. So this was a key recommendation from a legislator. The other thing that we learned, especially in the last year through the Alcohol Action Network, was that we have to be on the lookout for the new issues that are on the horizon. This became really apparent when we saw that industry was primed and ready to take advantage of the COVID pandemic to loosen control measures. And some of this was framed in, promoting local businesses, and certainly it's necessary to support local businesses. We want to see bars and restaurants survive shutdowns, lockdowns, closures, and restrictions, and so on. But they were really prepared, and they knew what was coming. And it became apparent that a lot of us in public health weren't as prepared or did not see ahead of what was coming at us. So this is our second lesson, that we need to look out for what's coming our way. A third important message in all of our different activities here, I think, that has come through is that we need to learn to communicate in ways that are accessible and useful to policymakers and to the general public. That this is one of the key things about bridging academic research and the policy making process. This actually is going to lead me into my next section here, where I'm going to talk about tips for plain language. I'm going to go over this fairly briefly. This was, in fact, part of my training as a public health researcher in social and behavioral health. There's a lot of information that you can find out there just with some simple Google searches, but I'm going to summarize a few key points that I think are especially important. One of the first ones is to avoid using jargon, the technical and scientific terminology. And this is really the downfall of relying on published scientific papers, because they are written for a very different audience, using jargon, using our insider scientific language. One of the key principles here is to just use plain common words instead. I pulled a screen grab from a website here. Carl Zimmer writes terrific pieces on writing in plain language and translating that scientific work into plain language. But here are just a few examples of better words to use instead of the things that show up in our typical jargon. But another principle here, and this goes hand in hand, is to minimize the literacy demand, the reading demand. So aiming for a lower grade level, and maybe lower than we would expect. I was taught in my health literacy class in my master's program to aim for about a 6 to 8 grade level, which might seem low, and a lot of people can read above that. But just because you can read at a grade 18 level, does that mean you want to read at that level? That it makes it much more accessible to lower the reading demand. And a rule of thumb that I follow is to look out for any words of 3 or more syllables and to see, is there a simpler way to say that? Are there shorter, simpler words? And sometimes it's a couple or few words that you have to use to replace that one polysyllabic word. But that is a good principle for plain language writing. Another one is to write in first person and active voice. It simply makes writing much more engaging. People are going to enjoy reading it. So here's just a simple example of a typical statement that we would make in scientific writing, saying the data were analyzed and hypotheses were tested. This is entirely in passive voice, accurate, but not engaging. We can change that to be more vigorous and first person, using first person language, saying we analyzed the data and tested whether X was related to Y and so on. Makes it much more engaging. Now, these are just a few quick principles that I think are especially handy from my experience, ones that I have used, but there's a lot of resources out there. And in fact, there is a good set of resources on this website, plainlanguage.gov, which I encourage folks to check out. Many more tips, much more detail than I can go into just in my short talk today. So I encourage you to use some of these tips to help bridge that divide, to bring this data to policymakers. The last thing I'm going to make is an appeal for the American Public Health Association. I'm going to ask if viewers here would consider joining APHA. This is a terrific organization, a wide community of folks involved in public health. And I believe that there is a home for everybody in APHA. Here on the screen is just a screenshot of the website showing all the different components. And in fact, we have the alcohol, tobacco, and other drugs section focused on substances, naturally. But there's also sections on public health law. There's a mental health section, a number of others, as you can see on the screen here. So I truly do believe that everybody can find a home within APHA. So with that, keeping my talk within about 30 minutes here, I'm just about at time. I want to give you my contact information. If you want to talk more about any of the ATOD section activities, about bridging scientific research with the policymaking process, I'd be happy to talk to folks, and I've included my email on the screen here. So feel free to reach out and contact me. I'm going to stop sharing here. I want to thank you for your time and attention. And as I said at the start, I look forward to speaking with viewers and other panelists in the live panel discussion that's going to accompany this. So thank you.